Mental health problems are very prevalent. A lot of emerging stressors like climate change, political instability, economic hardship, etc., have made young people's lives, really difficult. And in Kenya, almost 1 in 2 adolescents struggles with either depression or anxiety. But for these young people, help is often not accessible because of issues around cost, accessibility, and stigma. And so the work that we're doing at Shamiri is we are trying to address this problem of mental health by designing interventions that can be scaled. So the first is that we train high school graduates who are aged 18 to 22 years old. We train them to become lay therapists. So they deliver group-based therapy in Kenyan secondary schools. The second thing is that the lay therapists deliver a form of intervention that is mostly focused on improving human functioning, so training on things like gratitude, social support, motivation. And finally, our lay providers, they work within a tiered caregiving model that ensures that no one is left behind. So more specifically, if a kid has elevated symptoms of depression or anxiety, we can be able to escalate them to the second level of supervisors who are like social workers, who can be able to give them one-on-one support or refer them to the few psychologists and psychiatrists. With the FID funding is we've done a control trial where we tested whether the effect of the Shamiri model was different, whether the student received it from a partner or from the hub. And we found that actually it wasn't, which now makes us confident in pursuing both of these avenues for scaling. And so in particular, you're going to be moving from 25,000 to 100,000 this year on the basis of that learning. And the second thing we've learned that there is a really strong relationship between poverty and mental health. One, poverty is a risk factor for mental health problems. So if you're born poor, you may get depressed or anxious. And second, if you're depressed or anxious, it affects your ability to function. So our goal is to scale to 100,000 this year and to rapidly, within the next 3 years, move to serving at least 1 million people per year, right? And in so doing, show from the work we're doing in Kenya that this is a template that can be replicated in so many other countries in the world. And so the work we're doing with FID, which we're super grateful for, allows us to begin to build this framework and foundation for scaling to 1 million young people in the next 3 years.